Good afternoon, everyone. Thank you so much for joining us today for Provider Flourishing. This is an update from the Society for Health Psychology's Health Research Council, hosted by us, the Society for Health Psychology's Health Research Council, and importantly co-sponsored by the Society of Clinical Psychology, APA's Division 12. I'm Amanda Allman, a member of the Health Research Council, and before we begin, I have a few housekeeping items to share. First, this and all of the virtual presentations put on by the Society for Health Psychology are offered as a free benefit of your membership. Please invite your colleagues and students to join to ensure unlimited access to future presentation, as well as other lovely society benefits. This event is being recorded, so anyone who speaks during it, for example, to ask a question, is agreeing to be recorded and is granting permission for the recording to be posted on our website. Here's some important details. The webinar is also eligible for one continuing education credit under the Society of Clinical Psychology Division 12 sponsorship. Said they were important. The CE evaluation information will be sent to you via email. To all of those who attend the full presentation today, you'll receive that shortly after the webinar. We will leave the evaluation portal open for 1 week. So that's until 5 p.m. on Thursday, 5 p.m. Eastern time on Thursday, October 31st. CE certificates will then be sent out via email 5 to 10 business days after that evaluation period closes. And that will be sent to the email that you use to enroll for today's session. All participants are invited to submit feedback about today's via the evaluation, even if you aren't seeking credit. So now I'm honored to introduce briefly our panelists in no particular order. Today, the owner and founder of Scatty Sports Psychology is with us, Dr. Erin Ayala. Thank you so much for joining us. Myself, I'm Dr. Amanda Allman, Associate Professor at the City University of New York, the College of Technology. And our other Health Research Councils joining us here are Dorte Yunheno and her research assistant, Catalina Rubel, both from the University of Southern California. Dr. Lynn Havsey is joining us from St. Luke's University Health Network, where she serves as behavioral health faculty. And Dr. Alex Murray, a clinical health psychologist from the Cleveland Clinic, make up our wonderful panel today. And I listed them in no particular order. So these are our 4 main educational objectives for our workshop today. I will not read them to you verbatim. You're welcome to take this moment to read them to you. Allow me to detail them here, as well as the next slide, I'll go over kind of the impetus of this workshop today. So what you can expect to hear today is the value of emphasizing flourishing as providers of care. We're going to contextualize the concept in light of the events of recent years and also give you a unique lens emphasizing the importance of our unique identities and the differences between them. From understand the dimensionality of flourishing as a construct in the literature of psychology, as well as how it's operationalized in clinical research. We'll ask you to consider the role of yourself, the organization, when it comes to things like meaning making and how we develop or accept our values. Finally, we'll go over the core principles of flourishing, and by knowing this, you'll leave here being able to identify some techniques and resources. By identifying this construct, those techniques and resources should become more identifiable for you to implement in your organization. And as always, we'll have time at the end for questions. Forgive me. One more time. Okay. I want to share with you information about the American workforce as presented in the 2023 APA Work in America results. And later, these statistics I'll point out were brought to question by APA CEO, which I'll talk about a little bit in the next slide, but I want to start by embedding this information. The extent to which stress in the workplace is quite normal. So 77% of workers have reported experiencing work-related stress in this last month. And if we jump down to the point that's in bold beneath it, nearly the exact same percentage of workers report being very satisfied or somewhat satisfied with the support for mental health and well-being they receive from their employers. So while 77% of folks are stressed at work, 77% are relatively satisfied to the extent in which their employer as an organization supports their care for mental health and well-being. So when we look at these negative impacts or the stress that's related to work, we can see that over half of this type of stress is related or associated with symptoms of burnout. Those can include things like emotional exhaustion, lack of motivation, isolating behaviors, a desire to quit one's job, reduce productivity, irritability, and feelings of being ineffective. Recently, the pop sensation Chapel Roan talked about flourishing, and she said to flourish in her industry of music and entertainment, one really flourishes when they put care to the self aside. So I mentioned that because I think she's a pretty neat icon. I mentioned that to highlight that some environments are more burnout centric. The notion of burning out from the fatigue of one's job, especially in roles of caring as providers, is well known and well understood. So we know that burnout is something we want to avoid and prevent. We also know that it's distinct from flourishing, which I'll talk about in a moment. So these results were of the 2023 Work in America survey were brought to the APA, our organization's CEO, Arthur Evans, last year at the organization's convention in 2023 in a workshop on the topic of flourishing. He was interviewed by Derek Thompson, a well-known author at The Atlantic, who's written about flourishing in the workplace and really has like an anthropological, historical approach to the workforce in the United States. And so the first thing, I'm summarizing just a few key points. The first thing Derek Thompson did was describe flourishing in a very simplistic definition. He tried to do it in 6 words or less. And he said the idea of flourishing is a developmental trajectory, starting with the need to work, that work evolving into a career, and if we're lucky, that career feeling like a true calling of self, of where we belong. Another point he made when looking again at the historical evidence of workplace flourishing and satisfaction is that flourishing has hot streaks, that there are moments in time throughout our career where we feel like we're doing particularly well or feel like we're aligned with the mission of our work. And finally, an observation he had made in his work is the general notion that those who are doing well do acknowledge the context. I'm okay, but I can be okay knowing that the world around me, as he said, may be imploding. So when Arthur Evans responded to these results, he brought up 2 important things. And one of them is that he recognizes a shift in modern times for the employer being more than just a provider or, I'm sorry, a payer of healthcare. Employers feel the need to really bring mental health services to the employee. So I think that's one important contextual variable I'd like to point out. The second part here is what I like to call is the parameter estimates for the mental health needs of the American workforce. We breaks down the small percentage of folks in the American workforce who may have psychological distress levels to a level of clinical significance. So I'm using this kind of research jargon here to say when we talk about providers of care today, I want to consider what we know about the percentage of folks experiencing stress to levels of clinical distress. So I want to keep that in mind for each professional environment. There is a certain amount of mental health needs that are inherent to that. So finally, let me couple more things before we pass it along. I want to talk about the impetus for this workshop as discussed by the Health Research Council leading to today. Why have we turned from burnout prevention to flourishing? One is that, well, these are 2 distinct concepts, each worthy of attention. But because it's also kind of in vain, because I had mentioned we are in a burnout-centric environment, flourishing is something that can prevent that, but it also is really unique. So in recent years, the pandemic highlighted some of the systemic influences on providers' sense of well-being. Their ability to access resources, to be flourishing in the workplace, and to have the mental health support they need in light of the COVID-19 pandemic. So as a result of that kind of illumination of systematic concerns for our providers and those who are facing things like high rates of depression, we saw suicides of physicians and care providers being reported in the news and the media. We think that the lens for researching this topic really needs to center on the identities that those individuals may have. So a couple of the things that we've talked about as impetus for this workshop have been an individual's readiness to want to resist the culture of burnout. Some people may be inclined to maintain a status quo where burnout is the norm. So we acknowledge that not everyone is at that same level of readiness or preparedness to really resist this and turn more towards flourishing. We also recognize that there are differences in terms of generational status and different views on the role of meaning making in the workplace. We also see differences, not only this, but a host of issues when it comes to geographical locations and beliefs in the policies specific to those locations. So we understand that when studying this topic of flourishing, we want to take into account the identities and the group memberships of individuals. Conceptually, we'll talk about the self and the organization. And then finally, sorry, I don't know if I advanced that or if that was an error. We'll talk about the role of the self as well as the organization. And finally, we'll include stories about flourishing when possible towards the end of our presentation, because we think these stories or personal accounts can really explain something that 77% that we see in the workplace survey, that cannot answer that. We want to hear some qualitative stories of what flourishing looks like from psychologists. So today's focus, we're going to ask you to consider what is important to me in my role as a provider. Can I really be okay if work is imploding? We'll take a look at the results again of this survey. Those who have meaningful work are less likely to report stress during the workday. So we ask you to consider what is the amount of stress that you're willing to take when it comes to being in our role. Okay, I'm going to advance the slide. Maybe that's okay. We're still so what is the price we're willing to pay would be in our being in our role? I do want to take a note of privilege here, as you'll see the asterisk in our job, being mindful of our audience and who we're talking to. It's just a note of privilege that being in a PhD track professional role is one of privilege. One does not get into this position because they have to make ends meet. So flourishing, even though we're in our dream jobs and there is burnout, we want to be mindful of the discussion and who we're talking about and who it's for. If we know that flourishing has a trajectory in our career and there is a hot streak, we're going to ask you to think about, well, when and how should this happen? For example, can early career professionals really prioritize flourishing when they take a look at their organizational resources? Finally, we want to help you take this information so you can manage the barriers, both the barriers of the self and the barriers of your organization, and to get to a place of value identification and flourishing. So with all of that said, and I apologize for my slides kind of moving around there, I want to turn this to our next panelist. And some will be covering the literature on the concept, how it's been operationalized in research and clinical trials, and finally hear 2 case studies that exemplify this beautiful concept of flourishing in psychology. Thanks so much. Lynn, I'm going to pass it to you.
Thanks, Amanda. Sorry, I think I may have messed with your slides when
I went to hit my camera.
So sorry about that. And I'm just going to apologize in advance because I just gave a talk in another department, so I am like not at my setup. So if I'm like a little wonky on the technology, please forgive me. Okay, so I'm going to start with kind of a brief history of burnout. We'll give a little bit of a history of flourishing. And I also want to recognize that I did use AI to help me with some of this. But I thought it was really kind of a fun history in terms of like, I hadn't thought about it this way. But the Industrial Revolution, while the term burnout wasn't used, it was really the first time that a discussion of overwork, mental strain, and emotional exhaustion came into being. And if I had to hypothesize, it would be because we were putting people in workplaces and working on things together, right? If we think about factories and people weren't just doing their own trades. So then we jumped to the 1970s, and that's when we started talking about burnout and a state of emotional, mental, and physical exhaustion. And it was Herbert Freudenberger who did that for us. Many of us, if not all of us, are probably familiar with the Maslow burnout inventory, and that was 1981. Again, I had not really realized that had been around so long, but again, the Maslow focuses on emotional exhaustion, depersonalization, and lack of personal accomplishments. We then jump forward another decade or two, and corporate America starts talking about burnout and high stress jobs and corporate employment. And I think they probably had the term like work-life balance. I don't like that term because I think, even as Amanda began to allude to, like, it's never a balance. It's a seesaw that different parts are going to be up at different times. And can we integrate and make them work together? Because you just can't be putting your all into both at the same time. And then COVID came along, and the focus on burnout in healthcare workers, and right, we're the Division of Health Psychology. So I focus a lot of this on kind of like being in a health environment. So, okay, we go from that to talking about flourishing, and Aristotle, again, not using the word flourishing, but talked about eudaimonia and this highest human good, or living a life of virtue and meaning. And I think when we think about flourishing, it's this idea of like, where are we finding value and meaningful things in our life? The early 20th century, if we think about the focus in mental health and psychology and other mental health professions, was on treating mental illness. And I had to cut it out, but there's a talk from Dr. Marty Seligman when he talks about sort of this movement and how, we've moved from treating mental illness to working on sort of positive psychology, and that we can't just pathologize everything, that we also have to think about making the people who are okay better, or the things that are okay better. And that was sort of this 1990s, 2000, and the PERMA model, for those who aren't familiar, it's positive emotions, engagement, relationships, meaning, accomplishment, and the health, the H part got added a little bit later than that. And then in 2017, the Harvard Flourishing program really built on that, but felt that it was missing something. So they talk about happiness and life satisfaction, physical and mental health, meaning and purpose, character and virtue, and close social relationships. So the health was kind of new at that point, and the virtue was kind of new. And that's where sort of the add-ons from the Harvard program came from. So again, flourishing, if we feel good and we function effectively, we have high levels of mental being. So moving forward, again, to throw some more statistics at you, the 2024 Gallup survey said that the percentage of employees who strongly agree that their organization cares about their overall well-being plunged from 49% in 2020 to 21% in 2024, which just shows you, because those are really different than the statistics Amanda was kind of showing. So depending how we ask questions, we can really get different kinds of data and different information. And a previous survey had found that improving well-being and culture is rated much higher than increased compensation among sort of what became known as the quiet quitters. So I think that's really important too, to think about. We're not really going to spend a whole lot of time, but some of our early conversations were on generational differences. And really that it's not necessarily about titles and money, but this idea of culture and aligning with the workplace. And we'll talk a little bit more about that as we go on. So again, kind of similar vein, presentism is diminishing performance due to disease or lack of engagement. And those are our single biggest reasons for lack of productivity at work. So I think we often forget about whether it be chronic disease or acute disease, and that is also a piece. And then if we can't adapt and accommodate to that, we're losing productivity in our workforce, as well as engaging. Where can we get meaning into work for people to keep them engaged? And thinking about, are we, those of you in positions of leadership, are you really talking to the people who work for you and figuring out what's important to them? And is there a way to fit it in amongst all the other pressures of productivity? So some factors that affect flourishing are, again, management. Are employees respected, or is there care washing? Care washing is a term also out of, it was from the Harvard Business Review article that we read, but are places of employment doing what they say, or as managers, are you doing what you say, or is it you're saying one thing, but then, here, go attend this webinar on well-being as I send you 3 emails about things that should have been done yesterday. That's what an example of care washing would be. Piece I just mentioned, do people have some sense of control of their job? The psychological demands, how stressful is it? And is there psychological safety to talk about when something is like, when someone just can't function, and is there ability to figure out what some of those off ramps are to get them in a better place? Work organization, effort, and reward. Again, it's income and salary and benefits, but also how easy or hard is it to get things done? We often lose people when they just can't, the frustrations that they keep bringing to the forefront aren't acknowledged, or there's nobody trying to work on them. Even if we can't solve them right away, at least acknowledging and talking about steps will keep someone engaged usually. Again, that person environment fit, and do our personal goals and values fit with those of our workplace? Obviously, occupational safety and health are super important. I talked briefly about managing poor health and chronic health issues and the work-life integration piece. So as we look at that, again, really briefly, I just kind of did well-being in medicine, and that it really wasn't until the 2000s that we started to bring attention. And it was in 2017, so not that long ago, less than 10 years, that the ACGME, again, I work in graduate med, so I don't know what the UME standards are, but that it really became a focus in training for physicians. But again, it was really on the learners. It wasn't on the faculty or the people that are also educating and supporting those learners. And it was mostly on the well-being industry, that kind of that self-care piece, which I would argue is the bottom of the pyramid. And that we need to really be going beyond that basic bottom pyramid. And as we said, in 2020, COVID really brought all this to the forefront. So to lead in, I don't actually have time to ask you to answer this question, so I'll ask you just to think about it, but that how much of our personal well-being and our flourishing is our employer's responsibility, and how much of it is our own? And I'm going to argue that there's a piece of it that's both. So if we go and we think about this from that perspective, from a systems level, again, are actions supported with reality? Usually there's a financial argument that comes from the systems level, from the top piece. But I think the piece that gets forgotten is that people are really expensive, but they're the expensive piece that often doesn't get paid attention to. But turning over people is really expensive. It's expensive when you have vacancies. You're putting more stress on them, people covering them for them while you hire. It takes time to get someone onboarded and up to speed. So thinking about the long-term end game, and thinking about also, as Amanda alluded to, it's more than an HR benefit when we think about flourishing. It's more than just kind of what are we putting out in terms of our benefits package that we can advertise for everybody. At the team level, these are, our managers, our leaders are kind of middle level people. And some of you on this call may be in these positions, but are we looking at interactions between team members and colleagues? I heard, and I apologize, I can't remember what podcast I heard it on, but that all you need is like one close colleague to really feel connected to your workplace, just one. So are we building those teams? Are we building safe spaces? If you look at some of the team building literature, if you do team building activities and your team doesn't trust each other, it actually doesn't bring about that trust. It's almost like you need to have that trust for people to take those risks in team building activities. And then lastly, at the individual level, are we also taking responsibility for advocating to ourselves, for asking for what we need, for asking to add those pieces into our work that are meaningful and that we want to make time from, or to take away something that maybe someone else could be doing or that isn't necessary? And then within that, I'm going to argue, so same thing, there's these 3 areas. So looking at the self, looking at school or work, again, because there may be some students on here, and then looking at life in general. So not just those 2 domains. We're more than sort of ourselves in and out of work, but we're a whole person when we put it together, and not just an employee, and then an employee that goes home. So how do we increase satisfaction? What are some things we can do? So some of the things we need to be doing is targeting maladaptive perfectionism. So what does that mean? When we're in these high achieving careers, thinking about, again, we talked about these PhD levels and these we're all high achievers. You don't get here if you're not, but is the bar so high? Are we never satisfied? Are we always failing because we're reaching for perfectionism? Because perfectionism leaves no room for improvement. again, the imposter syndrome. When are we going to believe that like we worked hard to get here and that we deserve to be here? Performance as identity. So you are your best paper, your best test score, your best talk, whatever it is. Aren't you more than that? Does it have to be only the best thing? When do we stop comparing ourselves? Maybe we have different on and off ramps in our careers. Maybe we've stepped back or stepped forward at different times in life, and that we can't be putting ourselves in the same place, even of our cohorts that we graduated with. The personalization and the self-blame, again, when you aren't performing to expectations, is it always your fault? Or again, is there maybe a piece of you that isn't being supportive? And we teach our trainees about CBT and ACT and cognitive distortions. Do we teach them, and do we do it ourselves when it comes to our own focus and focusing on ourselves and helping ourselves get to those better places? So those are all tools. So I am really tight on time, so I'm going to go really fast here, but to leave time for everyone else. So just again, some things to pay attention to within the workplace too. We can't forget about those that are marginalized. And I think that's really important, that their story is different even than someone who isn't flourishing but isn't marginalized. Again, kind of these are pieces you've heard. The only thing I want to add is just workplace support, but I think a piece of that is also training leadership that can do the things we need them to do. So training leadership that can listen, training leadership that when we collect the data in our workplaces, can look at it and not say like, oh, they don't know what they're talking about, or I do that, but can actually look at it and say, how do we improve and how do we do better? And how do we use this measurement to have this culture of caring and culture of responsiveness? And then again, how do we get to that piece in general? We have to reframe the cynicism, the pessimism, the negativity, and the anger, right? We can't be blaming whenever things go wrong. We don't problem solve when we're blaming. We can't move forward if we're stuck in these negative stories that we're telling ourselves. And how do we tell ourselves stories of grace and beauty? How do we find the positives? I talk about, we had our retreat yesterday, and I am in Philadelphia, and it was like 80 degrees and sunny, and the leaves were changing in the trees. And we just took a moment to go like, I couldn't have asked for better weather if I had tried. And like, not only were we outside playing together in a park during the workday, but like everything else had gone right. How do we rewrite those stories? How do we cultivate those positive emotions? And focus on reducing emotional reactivity. Can we take that deep breath when we're really frustrated and angry, and before we react, right? All the things we train our patients and our clients, but are we training ourselves to do them, or training our trainees to do them? And then appreciative inquiry. And I think my last slide is just a wrap-up slide. So I am now going to turn it over to Dorte, who's going to tell you about some actual research that she is working on in these areas.
Wonderful. Let me just check and see whether I can advance. I can. Awesome. All righty. So it's a pleasure to be here today. I'm Dorte Young-Handel, and with me today is my wonderful colleague, Catalina Ruppel. And what we would like to do today is tell you a little bit about some of the empirical work that we've been doing on provider well-being and flourishing in the workplace at the University of Southern California. Please note that we'll be talking about an ongoing research project, so we won't be presenting any final results here, but instead we wanted to give you a brief conceptual and methodological overview of the ongoing project and share some qualitative feedback from our clinician participants and some notable observations. So let's get started. So what is Thrive? Thrive is a multidisciplinary collaborative effort at USC to pretty much systematically examine 3 different types of interventions to increase clinician well-being, decrease burnout, and enhance satisfaction in the workplace. And this study is supported by the UniHealth Foundation and is conducted in collaboration with Keck Medicine of USC, the USC Dornsife Center for Economic and Social Research, Care for the Caregiver at Keck, and the USC Dornsife Public Exchange, an organization which has really been instrumental in bringing all of us together for this wonderful project. Let's see here, next slide. So as you can see on this very busy slide, my apology, but Thrive is really part of the greater mission of Keck Medicine of USC to really determine care for the caregiver. And pretty much what it is, it's an effort to support flourishing in the workplace for all employees in the healthcare system at Keck Medicine. Care for the Caregiver, in addition to Thrive, also offers multiple different approaches to well-being, including support groups. We have workshops, hotlines, and also other tangible means of assistance, such as financial support for faculty and staff who are experiencing an emergency. The Thrive study is led by the principal investigators, Dr. Steven Siegel and John Broadhead at Keck Medicine of USC, and they received a 3-year grant by the UniHealth Foundation to conduct this randomized controlled trial. And as you've heard from Lynn talking, we know that flourishing can really be impacted by multiple different domains, such as the system level, the team level, and the individual level. And in the Thrive study, we're hoping, it's our goal, to pretty much target all 3 of these areas. Next, you can see our very large study team. It consists of many different people. Oops, sorry. Somehow the meeting controlled. Okay. It consists of many different people from various domains. So we have, with regard to the implementation side, our intervention leads cover clinical psychology, psychiatry, in collaboration with Care for the Caregiver. We have a clinical informatics team delivering an intervention, and also a performance and transformation team delivering another intervention. We further have a research and assessment team overseeing all of the assessments, and then a project management and dissemination team that is led by our collaborators at the Public Exchange. So the goal of Thrive really is a hard ask, as anyone knows who's conducted research in this area, to recruit 400 clinicians delivering care to people at Keck. And our recruitment started in 2023. The study will run through the summer of 2025. And in this RCT, there are 4 different study arms. There are 3 distinct intervention arms and 1 control arm. And clinicians who sign up for the study are randomly assigned to one of these arms. If they are assigned to one of the intervention arms, they complete 6 sessions, approximately over the span of 12 weeks. And we have objective as well as self-reported assessments at baseline, post-intervention, and then 6 months following the last intervention session. Our first intervention is really geared towards hoping to increase clinicians' well-being, and it's facilitated by our Care for the Caregiver group. And the goal really is in these sessions to teach resilience and emotion regulation through principles of cognitive behavioral therapy and acceptance and commitment therapy. Our second intervention focuses on performance improvement, and this is led by our systems re-engineering team. And pretty much these sessions try to help clinicians with the obstacles that they encounter in the workflow in daily practice. So these sessions are conducted in a team setting, because we all work in teams. We don't just work in isolation, in the hopes of really trying to provide processes and solutions for obstacles that people encounter on a daily basis on the workforce. And the third intervention focuses on EMR training. As we all know, it takes up a lot of time for clinicians to spend time with the EMR. And this intervention is facilitated by our clinical informatics team. And the hope really is to relieve the real-world burden of health system documentation in clinicians, and giving them tips and tools on how to better navigate the system. For our assessments, as I mentioned, we have objective metrics to evaluate the success of these interventions, but of course, importantly, also self-report data relating to clinician well-being, flourishing, their satisfaction, their perceived effectiveness at work. They are conducted at 3 time points throughout the study. And our self-report data, for ease of data collection, but also for convenience of providers, are done electronically. Ultimately, I think obviously our primary outcomes are geared towards enhancing flourishing and decreasing burden and increasing satisfaction in the workforce. But we're also hoping indirectly through these intervention approaches to positively impact retention of employees, but also patient care and delivery and outcomes. With regards to the broader impact, we're really hoping with Thrive to provide some evidence-based blueprints, almost like a roadmap, to really enhance clinician flourishing that can be implemented by hospitals all across the country. And to sum up, I would now like to give it over to Catalina. She's been doing some qualitative interviews with clinicians in the intervention arms because we're curious to hear in their own words what their experience has been. And so she can share some notable observations. Catalina.
Thank you for the introduction, Dirta, and thank you all for having us today. So as Dirta mentioned, my name is Catalina and I am the project specialist for the study. And now that you know a little bit about the study itself, I wanted to tell you about some observations that we've seen among participants that have completed the study. So when participants complete the study, they're given the opportunity to participate in the other intervention arms. And so far, out of the 76 people that have fully completed the study, 13 have requested to participate in the other intervention arms. And 9 of those people were originally assigned to an active intervention arm. So even after completing 6 sessions from their assigned arm, they're still willing and motivated to make time to do the other intervention arms, showing that once people are in the study, they do find real benefit. Additionally, we've been conducting qualitative interviews with participants once they complete their 6 intervention sessions, and we've got some really valuable feedback, so I wanted to highlight some themes and quotes from these interviews. Firstly, when asking participants about their motivation for signing up for the Thrive study, some participants heard about the study from past completed participants. One such participant heard about the study from one of his colleagues, and they found that the study was really helpful. So he expected that he would learn a lot through the study, and he said that his experience definitely matched his expectations. Additionally, some participants heard about the study through Keck's newsletters and flyers posted around the hospital, and they expressed gratitude that this is something that Keck is conducting and truly felt that leadership is trying to take care of their employees. Most participants found improvements in not only their work life, but also their life outside of work. In the EMR arm, one participant felt that they were more comfortable using the EMR, which in turn reduced stress and even enabled her to get to bed 1 hour earlier. Another participant said that they think providing new hires with the opportunity to participate in sessions like these would increase their work satisfaction, resulting in improvements in their well-being. In the emotional well-being intervention arm, participants have expressed that they're able to apply the coping strategies and stress management techniques that they learned about in their sessions to their lives outside of work. One participant said that participating in this arm allowed him to have a better outlook on life and view everyday experiences from a more positive perspective. Another participant from this arm said that the tools that they had learned from these sessions really helped her navigate her own personal relationships. In the performance improvement intervention arm, even though it's geared towards organizational and systematic improvements within the Keck environment itself, the benefits they found in regards to their work carried over onto their personal life. Also, participants could choose projects that were more focused on a personal goal rather than a systematic goal. And one participant chose this, and she said that focusing on a personal goal helped her make changes to her life, which improved her overall well-being. And another participant said that his project helped him focus on aspects of his life that he can control, rather than ruminating on things outside of his control. And we also looked at potential differences between nurses and providers. And interestingly enough, so far among the participants that we spoke with, there doesn't seem to be a difference between the professions. Some participants also expressed that they would like to continue attending sessions if these interventions were offered past the point of studies completion. So overall, participants that we spoke to that have participated in one of the intervention arms found that they were better able to thrive at work and outside of work. And if you have any questions at all regarding the study, you can reach out to me at clinicianwellbeingstudy@usc.edu. And I want to thank you again all for your time today.
That was it from us.
Okay. All right. Hi, everybody. So happy to be here today. My name is Alex Murray. I'm a clinical health psychologist at the Cleveland Clinic, and I use she, her pronouns, and I'm a member of the Health Research Council as well. This is such a meaningful presentation for me, I'm sure, like many of you, and I have just so many ideas percolating as everybody's talking about things I want to try to apply in my institution here. But what we're going to do for the next few minutes is just to dive in a little bit more into the individual domain of flourishing, right? So some of the really important, incredible work that's being done on a systems level and to really target leadership and team level flourishing you know, we know it takes a while for culture change to happen, right? So while we wait for those things to adapt, and we can obviously all come together to agree that burnout is not an individual problem triggered by personal limitations, right? That said, we do also still need to think about individual responsibility. And in preparation for this presentation, I was thinking of this as a parallel conversation that I have with a lot of patients as in my role as a clinician, in that there are certain things that we expect from your institution, from your healthcare team, and we still need you to be your own best advocate, right? So how do we, you know, how might we be able in the next few minutes to apply some practical techniques, and we'll look at a case example to bring this to bear a bit more. So one intervention, and one additional intervention that I want to bring your attention to is one that was completed out in Colorado, published in 2020 by Beecham and colleagues, that called See You Flourish. And in this intervention, they focused 5 sessions with physicians, medical residents, other healthcare providers within a medical setting, with roots in the PERMA model that was that Lynn outlined earlier, as well as acceptance and commitment therapy. So the factors that they looked at in this intervention with these healthcare providers started with understanding well-being as a concept, right? So let's start there with physicians and medical residents, right? Do we even understand what well-being is, right? And then from there, they focused different sessions on building mindfulness skills, unpacking the concept of grit, exploring and clarifying values, and cultivating positive emotions. What this intervention found after 5 sessions was increases in overall rates of flourishing, increases in ratings of workplace well-being, and secondarily, they found increases in mindfulness skills and self-efficacy to apply some of the PERMA model of well-being concepts to increase mindfulness skills and cultivate positive emotion. So in lieu of being able to take everybody here through 5 full sessions and really getting into the meat of each of these concepts, you know, one I think conclusion that we can make from this is that individual flourishing overall is going to be self-care driven, self-worth driven, right? Like, I understand that I deserve wellness, I deserve wholeness, right? It's value driven. So we are clear on just sort of at this point in time, right? Like, what are my values? What are my priorities? What are the things that I'm going to choose to guide my behavior, right? Values are what we do, right? So how do we put this into practice? It's mindful. Individual flourishing is mindfully aware of just what are my needs and what are my needs now in this moment, right? Not necessarily when I was hired, not when I was in graduate school, but at this point with everything that's going on. Flourishing is gritty, right? And we can think about grit a little bit more. You know, don't have a ton of time to unpack the concept as fully as might have been discussed in some of the work by Angela Duckworth and others. But grit, you know, it's defined as sort of perseverance through struggle, right? And while that can be helpful, right, in certain contexts, I think it's also important for us or at least in setting up our case example, right? I want to just make sure to say that there are times where we have to recognize, right, like there are certain things we're not persevering through necessarily, but we are going to take that mindful step back to understand, like, what are my long-term goals at this point, right? What is it that I can persevere through, and when do I have to have the courage to kind of reorganize my priorities and my time? And flourishing is boundaried, right? So we have to understand sort of where I need to set my boundaries in order to acknowledge, like, when am I not flourishing, right? And where do I have the control in order to set boundaries accordingly? Because ultimately there are plenty of things that are going to continue to be out of our control in terms of our institutional level, team level, you know, on a cultural level, sort of what's happening at this point in history. So where do I have control, right? Where can I set my boundaries? So to apply this a bit more directly, so we're going to talk about an individual example of a 34-year-old married white woman. She's an early career psychologist who secured her dream job at an academic medical center 2 years ago. Just became a new mom, so just back to work, 4 months. Her son's 4 months when she comes back from maternity leave. And she has a pre-existing sort of condition of having chronic headaches and body pain stemming from a congenital condition that seemed to worsen significantly after the birth of her son. So 2 guesses as to who we're talking about. So this was me. This was me 2 years ago. And I was feeling like I made it to this mountaintop, right? I got into my dream job, right? Had a baby, and then I was really confronted with a situation where I ended up having really debilitating pain and headaches that were barring me not only from doing my job, but also being able to show up in my role, as a mother for my son. And I was at a point where I realized that the only option really at that point was that I needed to take leave of absence from work in order to address my, my healthcare needs. And it came about that I needed to undergo neurosurgery in order to remedy this issue. And so that's what I ended up having to do. And really at that point, again, I had made it to this mountaintop, right? And I was feeling like I was really where I was supposed to be, where I'd worked so hard to be. And yet there were factors that were outside of my control that at that point really required me to reorganize my priorities and to work with my institution and my team and my leadership to figure out like what can be done, right? Can I continue to do the job, right? So at that point, right, when thinking about flourishing, really it was not flourishing, right? Like was not thriving, I was not functioning, right? And I wasn't burnt out, right? I wasn't at a point where I felt, emotionally exhausted or apathetic about my job or feeling overwhelmed with the work specifically, but I had to tap out, right? I had at that point, I recognized like I could not continue to push through. I couldn't persevere through this struggle. There were different priorities on my, that I had to attend to in terms of my family, in terms of, my health. So, so at that point I had real anxiety about my job, right? About my options for being able to take a leave of absence from work. I was getting feedback from, very supportive feedback from colleagues and leadership, but also some stressful feedback about expectations and productivity metrics and quite frankly, my concern for my patients, right? I was, having to step away from, I had a pretty high clinical caseload that I couldn't, I couldn't be reliably present. So there's burnout, right? And then there's also the fact that, we have to battle with some disappointment when we feel sort of barred from the ability to really show up in the ways that we want to, right? Again, I worked so hard to get here, right? And now how do I put this into practice, right? So flash forward. So really this does to confronting like, when am I flourishing? When am I not flourishing? What do I need to thrive, right? Sometimes we really have to reckon with our own vulnerability, right? So thank you to Brene Brown for all the resources and how to do this, right? But the idea of sort of interactions with our team, with our institution, what's possible, right? If we're not in a position where we feel like we are able to highlight and thrive, highlight our own well-being and thrive in that situation, do I have to climb a whole new mountain, right? Can I work with this one, right? Like, is this something that that is what can I sacrifice, right, in order to stay? And what do I need to re-clarify as far as my values are concerned, right? So how do my values at this point in time differ from previously? How do they align with or conflict with my institution, with my team members, with my leadership? What compromises am I willing and able to make, right? So, and how much meaning do I derive from the different parts of the job, right? So, and in my role as a clinician, I'm also expected to do things like service to the institution, teaching, supervision, research, conference presentation, and travel, right? Like, what if I can't do all of that, right? How meaningful is my job going to be without certain elements? What brings not only my job, but my life meaning, right? And how do we reckon with some of these moments where flourishing is not happening, but we are unsure of what needs to happen, right? What resources do we need to mobilize in order to help us with that? As far as the case example goes, right? So I did undergo successful completion of neurosurgery. I was able to access my medical leave and work with my institution to do so and retain my employment. I chose to sacrifice certain extra roles and work at a part-time status, which I had access to. I had the incredible privilege of accessing childcare throughout this process, which I think is also an incredibly important conversation to be having with our institutions in terms of what are those resources. The social support and peer mentorship that I received was vital, right? So talking about the connection to other colleagues, the importance of the connection and the rewarding nature of the work that I do with other colleagues really kind of kept me going, right? Is like, okay, I'm getting back to this, right? And then work-life balance, in terms of that, it is an ongoing effort, right? That seesaw, I love that metaphor, right? Of just how do we continue to sort of bounce back and forth between our priorities, and hopefully in a more holistic sense, show up as a whole person, right? So by nature, flourishing in terms of, the verb, right? Like how it's about growth, right? We grow through different hardships. We grow through confrontations with times in our lives and elements of our lives that shift how we grow and in which direction, right? So we might, not see certain things coming, right? So how do we continue to be mindful, ground ourselves in each moment to identify sort of what is it that we need, what is it that we have available to us in terms of resources, and how do we continue to empower individuals to take responsibility for their own growth and well-being within what are historically very rigid systems, right? So at what points can we continue to develop that grit, that courage to reckon with our vulnerability or with our roles when the price of the conflict between what we need and what our institution needs is too high, right? So I hope that this story and these techniques were helpful for you, and I will turn it over now to Erin Ayala.
Okay, thank you, Alex. You all teed me up so beautifully for this one. Whoops, I got too excited. Hold on. Okay. So I'm going to keep this as brief as possible so that I can be mindful of time. So I'm going to chop and very quickly kind of summarize my story, and hopefully my own passion and energy and excitement speaks to the benefits of taking leaps of faith, being boundaried, all of the things that Alex just said about like being mindful and being gritty and really, really values driven, because that's exactly the path that I have taken. So I am a very typical anxious achiever, perfectionist. I'm a avid endurance athlete who likes to do 200-mile bike races. I did the typical PhD publish and perish kind of track. I was bred to be an academic and go into academia and be a professor. And that's how I started. And that's what I did is in grad school, all of the things. I then secured a predoctoral internship and a postdoc in health psychology, working in academic medical centers, did a lot of research on self-care and health promotion. And then I got a job in academia for the first time. I thought I was like, okay, I'm on the right track. This is great. Visiting professor position, 5 new course preps in one semester, another semester, 500 undergrad students, while managing like 9 TAs, working well over, I don't even know how many hours a week it was, but it wasn't what I had signed up for. Found another job in academia, stayed there for a few years, and it was a PsyD doctoral program where they wanted their faculty members to practice what we teach by doing clinical work in the community. Unintentionally stumbled across a part-time sports psychology position and said, I'll see 8 clients a week. Once a week, I can do this. And so that's what I started doing. Behind the scenes, what was happening in academia as an early career professor and woman is a lot of microaggressions. I felt really stifled. I didn't feel like I was able to really be my best self. And so fast forward a few years and I made the leap to full-time work in sports psychology. And that was my dream job. Really, really excited to have made it. Exactly what Alex was saying, like, this is it. But a number of things happened. I felt stifled. Like the glove just didn't fit. I knew that there was something off. I felt like I was often trying to justify my decisions. We weren't on the same page. I had made it to the executive team, executive leadership, I had a seat at the table, but I didn't feel like I had a voice. And so I hit the job market. For 18 months, I was interviewing and I was like, I will do health tech positions. I'll go into like Whoop and Aura and biometrics and women's health. Like that'll be the thing. And then cue the massive layoffs that started in tech a couple of years ago. And all of the interviews dried up. And I was left with this decision and this reckoning. Do I stay in my dream job where I'm not actually flourishing or thriving, or do I do something different? I have never wanted to be a full-time clinician or go into private practice, and that's exactly what I did. And I have no regrets whatsoever. So I now have my own private practice. I've got a couple of part-time folks who support me behind the scenes. And I feel like I have made that transition from career to calling. I've never felt so fulfilled by my work. I have stress, yes, absolutely, but I get to control the dial. And as an overachiever, I often take on too much and burn the candle at both ends, but then I can correct. It's on me to do that, right? I get to select my clients. They all feel like dream clients. It's a really, really cool place to be. And I know that I wouldn't have done it if I hadn't taken a bet on myself. And this was just 18 months ago. I've got a full caseload. I've got a really extensive wait list because I love what I do and I'm good at it. But I'm also able to maintain those boundaries and being like, no, I'm not going to add more people. I'm not hustling for worthiness. It's not about productivity metrics. Like I get to turn the dial. So for anyone out there who is really struggling with burnout, feeling stifled, not sure where to go next, I'm going to drop my email in the chat. Feel free to email me. I love sharing my story. It is not one that I had anticipated or signed up for. And it's one that is just really, really refreshing and liberating in so many ways. So I'll leave it at that. So we've got 1 minute for questions.
Thank you so much to all of our speakers. Erin, thank you for being so mindful and chatting and then offering your email as a resource, as a result of that. I appreciate everyone. So thank you everyone here for attending the webinar. And let me read this, and I'll take as I'm talking. If there are questions, you can actually enter them in the chat because I just have some closing remarks about some logistics. So remember, if you would like the CE credit for attending, please respond promptly to the evaluation, which will be sent via email shortly. The evaluation will be open till Halloween, October 31st, 5 p.m. Eastern time. CE certificates to follow via email 5 to 10 business days. Please submit an evaluation even if you aren't receiving credit. I'll put in the email for the administrative team at the Society for Health Psychology for questions. Thank you again. I do see one in the chat, so I'd like to entertain. Oh, that's Erin's. Okay. Thank you so much to Brenda. I think everyone can see that in the chat. I want to be mindful of time. I also do have one question prepared. So if we can entertain that, and then we'll let everyone go. If you do have to go immediately, I completely understand. And I think Erin spoke to this a little bit. Everyone touched on this, is how can we get ourselves involved in naming some of the values of our organization? How do we get a seat at the table? Sometimes whether or not our voice is heard, right, is an issue, but how can we go about getting a seat at the table to influence the values and name those values at our organization? And I'll leave that to anyone.
I can just speak briefly on this. It can feel so intimidating to think of something like the values of the institution. I work in a huge health, academic medical center that spans several countries and is just this massive, it feels like this massive conglomerate, right? And I think that the idea of just how do we influence that, I mean, it can sometimes feel like screaming into the void, right? But to start on, I think that even just the comment that was made about having one work friend, right? Like one connection that ties us to the institution or that ties us to our team, right? Can be so powerful. And then collectively, right, advocating for either change on that smaller level. And if there are opportunities to give feedback and things like that, I think even if it does feel like, well, what's the point, right? Like it's the value driven piece is not about it the outcome of saying something being that change is going to happen, because we can't necessarily always control that. But you can control sort of your own intention of like, this is important for me to say that I said something, that I advocated in whatever way is possible, whether it's by email or feedback surveys or, you know, or to higher leadership, right? That if that's value driven, that it's still meaningful.
Thank you. And thank you for all the gratitude coming in the chat. So we're about done. We are out of time. Thank you again, everyone, for our wonderful panelists. Thank you for the Health Research Council, as well as Division 12 for sponsoring this as a CE bearing workshop. Steph, I'll hand it over to you to kind of wrap things up in the technical end. Thanks again, everyone.